Hello friends, this is AJ Webb, your SLV Health Wellness Coordinator. Today, I'm joined here with Lindsay Meredith from Human Resources.
Hi guys.
And today we're talking about wellness checks and why they're well worth it. This is kind of a play on words. Wellness checks, so we're talking about your wellness rewards, right? You went and saw your primary care provider, you played Virgin Pulse, you did all the things I asked you to do. Now we have processed the claims via HealthScope, and they're going to be putting in those checks in the next check run that they do. Down in the description below, there's going to be a link to an explanation of benefits. This is what you're going to want to be looking for coming out of your mailbox. It's going to have your check attached, and we don't want you to throw that away. So, about a week after this video airs, be looking in that mailbox for your check from HealthScope. Now, the other part of the play on words is, Lindsay, from a medical plan standpoint, can you tell us why wellness checks are well worth it?
Sure. So wellness checks in your preventative care is not only important to your overall health, but it's important to the overall health of our medical plan. By visiting with your primary care provider, you're able to evaluate your health and identify any factors that may be putting you at risk for other medical conditions. The more care that you are required to have because of your maybe some medical conditions that are identified, for maybe putting off those wellness checks for years and years because nobody likes to go to the doctor, you're going to have higher medical costs. Those higher medical costs are going to result in higher claims, which mean our plan costs rise. Rising plan costs means rising premiums. So the more you take care of yourself, the more you take advantage of those 100% free preventive services, the better off we're all going to be. You're going to be healthy, the plan's going to be healthy, and we're going to be able to keep more of your hard-earned dollars in your pocket.
More money in your pocket is never a bad thing. It's also a great opportunity to go meet with your primary care provider and continuing to develop a dialogue with them so that they know you better, they know your state of your wellness, the state of your health, so that you are able to have good constructive conversations with them, and you can go in and see them on your accord, right? You want to get in there early, speak with them, help keep you healthy versus coming in when you're sick or anything like that. We want it to be on your accord. Now, we know that these checks are important, these preventative care screenings, and they're so important we are challenging you to go out and get some of them done. Go see your primary care provider, get your mammogram, your colonoscopy, any of these different things that we've outlined in the wellness program. For every one of those that people submit to verify via the wellness, via the action rewards of the wellness program, Lindsay and I are going to be doing one squat for every action that's verified. So we're going to be tallying these up until the end of July. July 31st, we're going to count them all up, and then it's going to be time for Lindsay and I to pay up when we're going to be doing some squats for you. So this is a way for you to challenge us. We're going to be super uncomfortable, and we're going to ask you to go in, take care of yourself, right? That's what this whole program's about, is taking care of yourself so we can take care of our community to the best of our abilities. Lindsay, how would you like to close this out with?
No matter how small, any positive change is a step in the right direction, a step towards a healthier you to ensure a healthier, happier, and more prosperous life.
All right, thank you so much for joining me, Lindsay. Everybody have a super day. Be well. Take it easy.